In terms of nitric oxide, the first sign and symptom, and we call this the canary in the coal mine, is sexual dysfunction.
Really?
Because if you can't make nitric oxide in the blood vessels that supply the sex organs, then it's not isolated to the pelvic region. You have that same dysfunction in your coronary arteries. You have the same dysfunction in your cerebral arteries. It just manifests first in the sex organs, because if you can't make nitric oxide, you can't dilate the blood vessels. If you can't dilate the blood vessels, you don't get engorgement. If you don't get engorgement, you don't get an erection. And it's the same in men and women. The anatomy is a little bit different, but the physiology is exactly the same.
Yeah, I feel like understanding that for a man is pretty obvious. Is it as obvious in terms of sensation and physical manipulation in a woman?
So for women to have an orgasm, that is triggered by an increase in intralabial and intraclitoral pressure. Right? So it's an increase in pressure that really manifests and climaxes as an orgasm. So where does that pressure come from? The pressure comes from an increase in volume. The increase in volume comes from dilation of the blood vessels to get engorgement. That dilation is dependent upon nitric oxide production. So even in the female, if you're not generating nitric oxide in the pelvic region, in the sex organs, you don't get clitoral engorgement, you don't get labral engorgement, you don't get an increase in pressure, and women become anorgasmic. And you don't get to the secretions, so women develop dryness, painful intercourse. So it's the same thing. For men, it's a blood flow problem. But for women, it's secretions, it's sensitivity, it's lubrication, and it's orgasms.
Wow. So the number one sign that we are deficient in nitric oxide is always going to be that sexual function?
It's usually manifest as sexual dysfunction.